Hey guys, hey guys, hey guys. Hello everybody. Welcome back to my YouTube channel. If you are new here, welcome. If you don't know me, my name is Lasera Matapo and I am currently a 5th year medical student at Wits, and I'm on a journey to becoming Dr. Matapo. I hope that you enjoyed here. I hope that you like what you see. I hope that you watch other videos to give you an idea of a feel of like what I do, what we're all about here. But yeah, please don't forget to like, subscribe, and leave a comment down below. If you're new, let us know so we can welcome you properly. And yeah, thank you guys so much for your continued support. Thank you so much for subscribing, for sharing the videos, and for watching the videos. I appreciate it so very much. And just in terms of how I've been, guys, it's almost the end of the year, hey? And yeah, the energy is dying out a bit. Like, we're tired, exhausted, burnout is on the horizon. Like, it's been a lot, but we still trying to make sure that we make it through this academic year, that we keep fighting, we keep doing the most, give it our best nonetheless. You know, your best is always enough. Whatever it is that you're doing, as long as you're giving it your best, that is enough. And yeah, that's basically the motto that I'm carrying through for the rest of the year. I'm giving my best, and my best is enough. What I can do right now, the best that I can give is enough. So I hope that you guys are also doing well, that you're also giving it your best, that you realize that it is enough. And yeah, anyway, getting to today's video. Today I want to tell you guys about my family medicine rotation. So I'm currently in my last block of the year, last block of 5th year. It's actually so crazy, guys. Like, it feels like it was such a long time ago when I started, like, with my clinical years. It literally feels like it was ages ago, and so much has happened this year. And now I'm in my last block. So my last block consists of family medicine, ophthalmology, and psychiatry. So those are rotations that I'll be doing in my last block. My block is 6 weeks long, so these 3 will be done in 2 weeks, 2 weeks each. So yeah, so you guys, I'm gonna tell you guys about my family medicine rotation and what it is. And yeah, let's get straight into this video. Just say hi. Amondi. Hi. Hi, Samir. Hi, Fazad. So this is essentially where we were having our session. As you can see, there's like social distancing. All of us were fitted in here, and yeah, there's Marlene. So we're having our session here. We had our test here as well, and yeah, now we're just waiting for like our last session for the day, and then we'll be done. And yeah, we're just waiting. Shami looks hard. So we're just waiting for our doctor. She was here just now, but now we're waiting for her, and then we're gonna be waiting until like 4 to know our GP allocations, because that's another thing. The family medicine, we're gonna be allocated to GPs, so we need to know like where we're going and stuff, and we're starting it tomorrow. So we have to wait till 4 to know. I don't know why they make it such a, you know, like a big deal. You can just send it by email, so we all know. But anyway. Hi, Marlene. Marlene, come through. Show them the documents. Show them the documents. Show them the document. Show the document. Show the document. Oh, man. We got our placements. Oh, it took long enough. Anyway, guys, we're like going to the same area. Right? Yes. No wonder. Yay. We are so excited because we're going to the same area. So tomorrow we just don't know what time we're going to get there. Oh no, we know the times, but we don't know like the setup, what's actually going to happen. But we're excited. Tomorrow we're starting with our family medicine rotation, and we hope that it goes well. Anything from you, Nomonde?
I'm tired.
You're tired?
Already.
Mara future family physician, eh? What do you do, baby? What do you do? Marlene, anything from you? No. Anyway, guys, we hope that family medicine rotation is nice. We hope that we enjoy it, and then that some people.
Next week Friday must come now.
Ah, you? Yes. Hey guys, hi guys. Yeah, as you guys can tell, I'm tired. So I just came back from my first day of family medicine, like GP allocation things, and I'm so tired. So it's initially Marlene and I were gonna be in like Joburg Central, like in town, for our GP stuff, and then we got there and they were like, no, okay, they're gonna split us because there are only like three doctors there, and like yeah, it was a long story, not long, but like yeah, essentially they're gonna split us. So I split. I'm at like the other satellite thingy in Hillbrow, or it's in Berea, which is not far. Like it's literally not far from where I am. It's like an 11 rand Uber or Bolt, whatever, or on discount. But you can guess how much it is, right? So less than like 30 rand Uber from Res, and yeah. So in terms of just my experience as a whole, I need to eat first so that I can tell you guys because I'm so tired. But yeah, it's not too bad. Hey, essentially I'm gonna be going in from 9 to 1. I only came back late today because I got there later. But like, I don't know what I'm doing. But anyway. Guys, I am on my way to get an Uber. It's a bit gloomy today. I don't know if you guys can even see me. But anyway, on my way to get an Uber. Oh, child, I need to fix my hair. I'm so tired of it. I always struggled with Ubers. Well, yesterday I struggled with an Uber. I hope today I don't get issues. And yeah, I'm gonna be there by 9. And yeah, I forgot my name badge though, but it's fine. Anyway, guys, I'm wearing a lab coat today. Bye. So family medicine is a rotation that basically focuses on how can I put this? It focuses on patient-centered care, right? Sort of, it focuses on patient-centered care and having a holistic approach to healthcare, and not necessarily a disease approach, but rather a patient approach, to healthcare. Because as doctors, it's very easy for us to focus on the patient's diseases and not necessarily the patients themselves. Sometimes you find yourself saying, oh yeah, no, the ectopic lady, or no, the diabetic foot guy, and basically what this rotation says is that we should focus on the patient and who they are. It is somebody who has a disease. It's somebody who has a certain illness, and our focus shouldn't necessarily always be on the disease itself, but the person with the lived experience of having the disease, right? So as we know, the World Health Organization defines health as a state of complete physical, social, and mental well-being, and not merely an absence of disease or infirmity. So essentially, that's what this rotation is all about. It's about having a biopsychosocial approach to healthcare, and what that is, bio basically speaks to the biomedical aspect of things, the disease aspect of things, right? Psycho, the mental well-being, the psychological state of the patient, and social, the society that the patient comes from, the environment, the family, right? So the focus is not only on the biomedical side of things, but a biopsychosocial approach to a patient's well-being. It's a patient-centered approach, and that's basically what we're doing. Initially I thought that this rotation was going to be very boring. I won't lie. I was like, ugh. All we do is just talk. There's no like rush. There's no resuscitate. Oh my gosh, bring this. I was like, oh my gosh, this is gonna be very boring. But I've actually got a new respect for this rotation and this sort of discipline in medicine, and I found it to be actually quite very important. So essentially, what we did, or what was done, is that we were allocated to have to be with general practitioners, right? So in the first 2 days of rotation, we had like an orientation sort of thing where they taught us basically about family medicine, an approach to it, how we deal with certain things, how we see patients and stuff like that. And for me, that was where I actually started to gain a respect for this profession and realize that this is actually the medicine that I wanted to practice. This is actually why, or some of the reasons why I actually wanted to get into medicine. Having a patient-centered, biopsychosocial, holistic approach to healthcare is actually something that I was passionate about from the get-go. One of the reasons why I know people say I want to help people. I don't only want to help in terms of making sure that you don't have a disease, but just the biopsychosocial aspect, a holistic approach to it. I realized that it's something that I actually love, and yeah. So with the family medicine rotation, we were there sitting with the GPs in their offices, and as patients came in, would discuss what's going on with the patient and stuff, and also talk to the GP himself or herself about what's actually happening, you know. And I think for me, I realized just how important listening and communication was in this rotation, because, like, for example, when a patient came in saying that she's feeling very depressed, and we later found out that it's because her and her partner broke up and things like that. She's struggling to sleep and stuff, you know. And for us in that consultation, it wasn't necessarily like anything where it's like, oh my gosh, this. It was more of she needed somebody to speak to, and we needed to listen and communicate effectively with her. You could tell from how she's doing, even before she told us what's going on, just from when she walked in, sat down, how she was looking, the posture. So essentially that's what it taught us, to listen to the patients through their body language, through how they speak, the tone of their voices, and not necessarily listening to only the words that they're speaking, but how they communicate to you as a general practitioner or as a doctor through different things, you know. And now in that consultation, started inquiring a lot about like her family, her support system, and everything that encompassed the patient as a whole. And I feel like for me that made all the difference, because I got to consult that lady myself. So like I went to a separate room and I was consulting that patient, right? And I got to talk to her and just find out, you know, she literally had biologically, biomedically, she had nothing wrong really going on with her. She was just very sad. She came in saying that she's feeling depressed, but essentially she was just really sad about the breakup. And I just talked to her about it, spoke to her about her family and everything that's going on, her support structure, her child, you know, all of that. And for her, she felt very good afterwards. It wasn't necessarily that I wanted her to focus on like, oh, what drugs do we give you? Oh, this, oh, this, oh, this, oh, this. No, but to say that as a patient, there's a lot that influences your overall health. And that's what we should be looking at, the different factors, the society that you come from, you psychologically, biomedically, what's actually happening with you, you know. So that was beautiful. And I think for me, that's what I liked about this rotation, the fact that you met people in their communities, where they live, and you got to know the things that sort of have an influence in the overall condition of a patient. Because in hospital settings, you just see a patient coming in, you managing, oh my gosh, having a heart attack, you're focusing on that. You're focusing on the heart attack, you're focusing on the heart, you're focusing on stabilizing this patient. You don't know who they live with, who they get along with, who they don't get along with, what they have access to, what they, you know what I mean? Like, our focus is so much on treating that condition, but we don't actually know the patient as a whole. And in this rotation, you get to sit down and just speak to the patients, you know, get to know them. And I think what I liked about this rotation is that there's a sense of continuity of care, you know, because in the hospital setting, you see a patient now, they might be gone tomorrow, you might not be seeing the same patients tomorrow, and then you only manage it right then, and then you move on. But in this setting, you get to know the patients, you get to watch them grow, you get to know their families, their friends, where they live, what they do for a living, and stuff like that. So you get to be part of the growth of the patient, you get to see how their health changes over time. There's a level of continuity of care, you know. And I remember my GP, one of his patients came who hadn't come in like 10 years or so, and he still remembered stuff about the patient, like, oh my gosh, have you managed to actually sell your car, because I remember you wanted to sell your car, you know. And the patients, you can tell that they feel very valued and very cared for, because somebody is listening and they're remembering all these different things about them and things that make them who they are. You know, as a doctor, you recognize that this patient is not just the disease that they have, but there's so much about them that you learn and you start to sort of value about that patient. And that influences your choices as a doctor, how you treat and how you manage the patients, you know. So it was very beautiful for me to see. And I think I also realized that family medicine is actually not easy, because unlike in hospital, again, as I'm saying, you're not working in an obstetrics ward, you're not working in a surgical ward, you're not seeing patients who have heart failure or whatever. A patient comes in undifferentiated. You're basically dealing with an undifferentiated patient, and what I mean by that is that you don't know if this is a cardio case, this is a resp, but this is an obstetrics, it's a whatever. You have to sort of work your way to figuring out what is actually going on here. This patient comes in with chest pain. Are they having a heart attack? Is this anxiety? Do they actually have reflux? So it's an undifferentiated patient, and you are working with so much, and you have to sort of make sure that you like ruling out all these different things and working towards finding out what's actually going on. And I realized that for me, I've been exposed to so much of the serious and like the more exciting stuff, that when it came to actually dealing with smaller things like a cold and stuff like that, I was just very like, okay, like, what do I do here? Like, okay, it's just a cold, you know. And I realized that for us, we're so focused on the big things that we forget that there are also small things like the cold, you know, like the child who's just coughing and having a cold and having snorties, that you have to help. And that also is part of medicine. Medicine is not only just running around in the emergency department, people are being stabbed, oh my gosh, this. No, there's just also the common things that people come with, you know, the things that you see on a daily basis and stuff, because that's essentially the bigger part of the population. They have all these not so urgent conditions that don't need referral to like tertiary hospitals. And it was very challenging for me to downscale from that, because when a patient came in with like chest pain, I was like, oh my god, okay, chest pain, tell me. And it was like, okay girl, calm down. This could just be ulcers, it could just be a reflux, it could just be, you know what I mean. And yeah, I think I've learned a lot from it, I've grown, and I have a respect for it, a newly found respect, you know, because the patients that we saw, I remember there was a guy who came in, they were having marital problems, like in terms of like reproductive, you know, and it's something where you have to give a level of empathy with every patient that you see. There's a level of empathy and understanding that you have to have, you know. When a patient comes in and she's pregnant, comes in with a partner, they want to see the scans, they're excited about those things, you know. It's not like people just giving birth, they want to know how the baby's doing, you have to speak to them, oh my gosh, this, show them the scans, the partner wants to see it. Maybe another guy comes in and maybe they're having like, he's having problems with his ejaculatory system, or you know, like things like that. And you're like, oh my gosh, okay, how do I approach this? You know, I'm a lady, he's a guy, maybe he feels awkward about it. How do I go about this conversation in a way that they can divulge information about what's going on, but still feel safe, still feel comfortable, you know? So that's what it was essentially all about. And I think for me, my highlights in this rotation was basically there was this lady who came in, she was having a cough and stuff, and it was just a common cold that she was having. And we saw her, examine her and everything, and so the doctor wrote down the prescription and everything, and we were done seeing her. And then as she was leaving, she stood at the door and she looked at me and she said, you know, you made me feel very, very calm, and I feel like you've got this calming energy about you. I loved being seen by you, and I trust that your patients in the future will actually love coming to you as a doctor. You're gonna make an amazing doctor. And I was just like, oh my god. It made me feel so mushy and stuff. I was like, oh, that's so cute. Like, thank you. It was so affirming. It was nice. And I was just like, okay, I guess you're doing this right. So yeah, that's basically what my rotation was all about. Family medicine, holistic approach, and meeting the patients where they are, knowing all about the patients and not just the diseases that they present. And yeah, medicine is not just about diseases, medicine is about patients. Medicine is about understanding everything about a patient, who they are, where they come from, and the illness that they have. And yeah guys, that's basically it about this rotation. I hope that you guys enjoyed this video. Don't forget to like, subscribe, and leave a comment. Until the next rotation, until the next video, I'll see you guys next time. Bye.